The World Health Organization has declared Mpox, also known as monkeypox, a public health emergency of international concern for the second time in 2 years. It's sparked by a new variation of the virus originating in Africa. And while it has not been detected here in the U.S. yet, it still has experts paying attention. Matt Mathias is in our control room with more tonight. Matt.
Yeah, that's right, Jen. The World Health Organization says this won't be the next COVID-19 situation, but with cases and deaths jumping in Africa and surrounding countries, there's talk that it could spread over international borders. Mpox spread to over 70 countries in 2022. Then, according to the Center for Disease Control, it impacted mostly homosexual and bisexual men. This new iteration of the virus, being called Clade 1, spreads much easier and brings with it higher rates of mortality.
That's very different than what we had 2 years ago in the country, which was Clade 2. That is still here. Even 2 years ago, Clade 1 was known.
According to scientists studying the disease, it's thought up to 10% of people who contract this mutation of the virus could die, depending on healthcare and pre-existing conditions. So far, it's been detected in 13 countries, most recently in Sweden.
It mainly manifests as skin lesions, painful, sort of warty-like lesions, along with some symptoms of fever and chills. And the number of lesions seem to be more, and it seems to be lasting longer.
People at most risk are those with compromised immune systems and children who get it through poor hygiene or skin-to-skin contact with others when playing. However, risk here in the U.S. is considered to be very low at this time. And while there are no cases of the Mpox variant in Erie County or the United States, it's something infectious disease experts are still keeping an eye on.
When there is opportunity to transmit, viruses multiply quickly and they mutate very fast. If the mutation is favorable, they thrive faster. But I think it's always good to be conscious of, has someone traveled recently? Has someone had a sexual encounter with somebody who may have it, and to be aware of that.
Now, again, there's no concern of the new variation of Mpox in the U.S. at this time, but vaccinations are available for people who may be at risk.